Hello, everybody. I am so excited to be joining you from the Body Smart Studios for our first day of our Ultimate Back Pain series. So we are going to go through some awesome stuff tonight and throughout the rest of this week. So super excited to have you on. I'm just going to tag everybody really quick that said that they wanted to be tagged. So hold on. Boom. So hopefully that gets out to everybody that wanted to be tagged, or at least most everybody. Looks like we're missing a few. Oh no, it looks like we got them. So excited then to have everybody here with me so that we can get going. Back pain, it's something that is everywhere. We talked about that yesterday. You know, it's 60% of all physical therapy visits are back or neck pain. 60% of all emergency department visits are for low back or neck pain. So it is this huge pervasive problem. Everybody's got low back pain. And if you don't have it, chances are you know someone that does. And so it's big, huge problem. We definitely want to get rid of it. So how? How do we get rid of it? How do we get back to life? Well, the first thing is identifying what causes your back pain, what type of back pain you have, and that helps us better determine how we're going to treat it. So tonight we want to talk about the three primary types of low back pain. And now this is definitely a broad generalization of types of low back pain, but they generally fit into three main categories. And so we're going to spell that out for you tonight. So the three main types that I like to talk about are muscle sprains or strains, disc-related issues, and then bone or joint degeneration. So really age-related degeneration, including arthritis and disc height narrowing, some other things like that. The reason I group them together like this is mostly because of how they're treated often, but also the type of symptoms you tend to get with each of these. And so let's spell out for each of these what type of symptoms you get so you can better understand maybe what type you might have. So muscle strain or sprain it's one that typically affects younger people and active people. Not always, but you usually have to be doing something to strain that muscle. So it can be somebody that is inactive and then tries to be active, but it's usually during activity. Hurts to move most of the time. It's kind of one of those biting pains. It's like any other muscle strain or sprain, honestly, where when you move, especially that muscle in that way, it hurts. And so it's something that typically, like any other muscle strain or sprain, it typically resolves on its own eventually. We can definitely speed that up with making sure we do gentle exercise and getting the right hands-on care early enough. We can really resolve a lot of the symptoms and help reduce the length of time that that's going to take. And so we'll talk more about that tomorrow, about how to resolve those muscle strain and sprain type injuries quickly and get as much help there as you can. Type 2, disc-related problems. So this is one that, again, typically affects younger people. It comes by many different names: disc bulges, disc protrusion, ruptured disc, all kinds of other things that you may have heard. They're kind of broadly lumped into a similar category of things. And so with these disc-related problems, they typically affect people of working age. And these type of people are the ones always squirming with their low back pain, trying to find that comfortable position, right? Prolonged positioning is usually one of the worst things for them. They hate it. So sleeping at night can be really painful and awful. Sitting is usually one of the worst things, especially car rides, airplane rides, things like that are miserable. And so these type of people, they tend to do better with movement, difficult with prolonged positioning. This often comes with those radiating symptoms, down into the top of the buttock or down the leg. No fun for that. It can be serious. They can last a long time sometimes. And so we definitely don't like these symptoms. And that's something we want to get on top of right away. This is something I'm not a fan of treating this or type 1 or type 3, honestly, with narcotics or even muscle relaxers or things like that. we'll get into that more, but it's something that I like to get people in ASAP, as soon as possible. Get in. I would say, even if you're suspecting that that's what's going on, I would skip the doctor and come in and get treatment right away from a doctor of physical therapy, so that we can start that pain relief process. And if we feel like you need to go to the doctor and get scans and x-rays, we can totally go down that road. But I would get pain relief right away. And again, we'll talk more about that, but there's your warning. Get in and get help right away. The other thing that is really common with this is that it lasts a little bit longer. It's not just a couple of days to a couple of weeks. It's usually weeks to months. And some people can have recurring symptoms with their discs over the years. And so definitely one we want to get in, get it resolved as quickly as possible, so it's not a huge lingering problem. Okay, type 3 symptoms are more of those age-related, long-term life kind of wear and tear problems. And so they typically present a little bit differently. Typically, it's people over 65, not always, but more often than not. It's people more kind of retirement age. As life slows down, they slow down, and all of a sudden arthritis and movement kind of catches up with them, or lack of movement catches up with them. Typically, people that continue to move have less issues with this, but it can catch up with anybody. Genetics definitely plays a big role. These people tend to feel more problems with movement and activity. It's an aching pain that tends not to go away quite as much. Sitting actually and rest typically feels good, versus activity with the other two types tend to flare things up or bother it. Or activity helps, and sitting tends to bother it. With this one, sitting actually feels good, rest feels good. Standing and walking can often be painful. Not always, and we like to get people to a point where they can walk and be active and it not be a problem, and actually help decrease their pain. This kind of pain is usually a constant pain, and then sharp pain off and on, depending on what the movement is. Essentially, the idea is we've got the building blocks of our bones stacked on one another, and the nerves come out, and the bones themselves have degenerated a little bit. We get arthritic changes, so they just don't move where two bones kind of pair up with one another. Those are called facet joints. If there's arthritis in those, so that they don't glide on one another the way they're supposed to for proper back movement, causes a lot of pain and problems. And then we also get disc height narrowing. And what happens with both of these things is, with restricted movement, so things don't move right, as well as our discs getting narrowed, as well as some other degenerative changes that we can see. A lot of the time what happens is it can make the spaces, the holes where the nerves come out of the back, a lot smaller, so that there's not room for those nerves, and then it pinches on those nerves, and that's where we get some of the sharp pain. And then the dull achy pain is just from the restriction in movement and some of those other things. And so this one, it can really be a bugger, because it doesn't typically go away without treatment, because it can't necessarily heal. It's always going to be there. Some of those arthritic changes and just age-related changes, they're always going to be there. And so we just work on mitigating the symptoms, making sure you're strong enough and flexible enough that it's not going to impair your quality of life as much. And so we can do a lot to help these people, even resolve their pain almost completely, but we can't change the changes in their back. We can just help them to be functional enough and strong enough that those changes don't necessarily affect their movement or their quality of life. That being said, not everyone can always be helped with this case, but we love to avoid surgery, avoid pain pills. Occasionally people do have to get injections, but we try to avoid that as well as much as possible. But again, we'll talk a lot more about that later. So those are the three main types of low back pain that we talk about often in the clinic. Again, those are muscle sprain or strain, disc-related problems, and bone and joint-related degeneration. So what category do you fit into? Do any of those fit you and your body and your body or your pain, I guess? If so, definitely tag yourself, I'm in, so that you can get help with that. Because tomorrow, We're going to be talking more about how to help with the muscle pain and strain. We're going to talk on Friday more about on Thursday more about disc-related issues, and on Friday we're going to be talking all about these degenerative changes. And so we'll give you more specific tips and information on how to resolve these things, how to eliminate that type of pain so that you can get back to your life. Really, the biggest thing with back pain is it's kind of scary, right? Because we don't know really what's going on internally, and we want to be able to get back to life, to get back to doing what we love to do, to being the person that I want to be. And we can't do that when we have this constant nagging pain from low back pain or upper back or middle back pain. So when those things really affect us, it really affects every single part of our life. Hey, Joni, thanks. Yeah, we'll make sure to tag you then. Love it. So that's exactly, we want to help you get back to life and living and being able to live every part of life without pain, without the fear of pain, without the fear of, is this going to make things worse for me? Every time that I move, every time that I exercise, am I going to be suffering from that? I want to give you the ability to exercise, to live life, to enjoy your kids, grandkids, to enjoy your job without pain. And so that's why we're doing this back pain series, and we're so excited to be able to give that to people, at least that head start, that leg up on how to start resolving your symptoms today and what to do about it, how to make the decisions of whether or not I should go in and see somebody, how to make those decisions and how quickly should I be seen, what types of treatments are available for me. We want to answer those questions for you so that you can get the best type of care as quickly as possible and resolve your symptoms and get back to living and get back to life. That's what we're all about here at Body Smart. We want to teach you so that you can become Body Smart, about how your body works, about what you need to do to treat it right so that you can resolve your symptoms, whatever they may be, and get back to living your life. So hopefully we've taken that first step tonight in defining those 3 types of pain. Make sure to tag yourself so that we can make sure you get in, and you can learn more about what type of pain you might have. So take a look at those on the post there. It labels some of those things specifically as to what defines each category. So figure out which one fits you, and we'll be able to talk about it more in the coming days. So look forward for those posts in the evening on both Thursday or Wednesday, Thursday, and Friday. And then Monday will be our big reveal of kind of the conglomeration of everything put together. We'll give you a bunch of tools and resources on how to start eliminating your back pain right away so that you can get the help you need. All right. If you've got any questions, feel free to comment and post them below. Happy to answer those at any time. Also, make sure to tag yourself or anybody that you know, love, or care about so that they can get this help too. Just tag them or just put "I'm in," and we'll be able to get you the help that you need. All right, thanks so much. We'll catch you later. See you tomorrow.